Chapter 9, Electronic Health Records. As defined in Chapter 1, an EHR is an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and that authorized clinicians and staff across more than one healthcare organization can create, manage, and consult. With its seminal publication entitled To Err is Human: Building a Safer Health System, the Institute of Medicine, now the National Academy of Medicine, advocated for the use of health information technology, or HIT, to help prevent many of the mistakes that regularly occur in the delivery of health care and that lead to the injuries and deaths of thousands of patients. Health information technology includes the hardware, software, integrated technologies or related licenses, intellectual property, upgrades, or packaged solutions sold as services that are designed for or support the use by healthcare entities or patients for the electronic creation, maintenance, access, or exchange of health information. A longitudinal health record is a permanent record of significant information listed in chronological order and maintained across time, ideally from birth to death. Access to the EHR should not be limited to the healthcare facility, but rather be accessible remotely for providers as well as the consumer. The EHR should not be confused with an EMR, or electronic medical record. An EMR is an electronic collection of all of the patient's health information and clinical care that is stored, managed, and referred to by authorized members of one healthcare entity, much like the actual paper record, only in digital or electronic form. The EHR must meet national standards for interoperability set by the Office of the National Coordinator for Health Information Technology, or ONC. Interoperability is the ability of different information technology systems and software applications to communicate, to exchange data accurately, effectively, and consistently, and to use the information that has been exchanged. An EHR is a system in which the clinical information is utilized for the following purposes: reimbursement, diagnostic and procedural coding, claims processing, computerized provider order entry, or CPOE, and results reporting, e-prescriptions, medication management, population health reporting, quality improvement activities, clinical decision support, healthcare facility administrative reports and analytics, and other authorized activities. The EHR is a collection of multiple technologies and systems that work together. Source systems are information systems that capture and feed data into the EHR. Source systems include the Electronic Medication Administration Record, or EMAR, the Laboratory Information System, Radiology Information System, Hospital Information System, Nursing Information System, and more. Source systems are not just clinical systems, but also include administrative and financial systems. EHRs include a Continuity of Care Record, or CCR, and a Personal Health Record. The CCR is a core data set, which is the most relevant administrative, demographic, and clinical information about a patient's healthcare, covering one or more healthcare encounters. The CCR is not the minimum data set for the EHR. It is only information that is deemed most important for the continued care of the patient. ASTM International, a standards development organization, has established a core data set defining the minimum requirements for the CCR. Data contained in the CCR, as shown on page 147 of your textbook, can be provided to care providers in an electronic format using extensible markup language or XML or Health Level 7 international formats, as well as traditional payment for paper format. Health Level 7, or HL7, is a not-for-profit American National Standards Institute accredited standards developing organization dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing, and retrieval of electronic health information that will support clinical practice. HL7 is an important standards development organization that is most focused on data exchange standards across health information systems. The Personal Health Record, or PHR, is an electronic or paper health record maintained and updated by individuals that can be used to collect, track, and share past and current information about their health or the health of someone in their care. The Office of the National Coordinator for Health Information Technology, also known as the ONC, is the lead federal agency spearheading this national effort to improve patient safety and health outcomes. The ONC is responsible for advising the Secretary of the Department of Health and Human Services and for establishing guidelines and requirements for the adoption of HIT. The ONC coordinates all efforts to develop and implement the nationwide health information exchange and its infrastructure to help improve healthcare in the United States. The ONC created the Meaningful Use Program as a way to spur the acceptance and adoption of HIT and EHR usage in health care by using certified EHR technology. CEHRT, Certified Electronic Health Record Technology, is used to improve quality, safety, and efficiency, reduce health disparities, engage patients and family, improve care coordination and population and public health, and finally, to maintain the privacy and security of patient health information. Meaningful use also incorporated quality of care indicators and reporting requirements to evaluate the impact of EHR adoption on healthcare quality, patient safety measures, and provider efficiency. There are still obstacles to overcome. Many healthcare providers are not eligible for a variety of reasons for the MU program, and hence their adoption of EHRs still trails behind those who participated in the Meaningful Use program. Interoperability is still a sticking point. Standards for EHR systems and implementation lack specificity. Best practices have yet to be refined, publicized, and consistently implemented. Health information blocking is also an issue. Health information blocking occurs when persons or entities knowingly and unreasonably interfere with the exchange or use of healthcare information. Blocking stems from healthcare providers or HIT vendors protecting their own proprietary and business interests above the interests of the patient and healthcare improvement. Certified EHR technology has been evaluated by a member of the ONC authorized certification bodies, and verified that it meets the criteria set by the Meaningful Use Incentive Program. The testing of the EHR product is performed by the accredited testing laboratories. Once the testing confirms that all standards have been met, the ONC-ACB awards the certification status. Health information technology is certified as subject to surveillance activities as a condition of certification. Certification of Surveillance of certified EHR products and vendors ensures the continued maintenance of the functionalities required by the ONC. All certified products are subject to surveillance to make sure the product's capabilities are maintained by the vendor and that it is capable to perform its function in the real world and not just in a testing laboratory. There are four main areas or systems within an EHR. See page 152 of your textbook for a conceptual model. Ultimately, EHRs are far more complicated. However, for the purposes of this textbook, we will just start with the registration, admission, discharge, and transfer system, patient financial services, order communication and results retrieval, and then ancillary clinical and department applications. They also include patient monitoring systems, document management systems, clinical messaging and patient provider portals, results management, point of care charting, and computerized physician or provider order entry system, the CPOE. In addition, there's the electronic medication administration record, clinical decision support system, health information exchange, and population health. The benefits of the EHR are many and varied. For one, it offers easier access to clinical information. It also provides current information on tests, medications, allergies, past diagnoses and treatments, all required for decision making and disease management. The EHR provides tools such as reminders and alerts. Enhanced documentation is also captured. The EHR allows healthcare providers to spend more time with patients, although that's debatable. Test results can be available immediately upon completion, and the EHR supports various data analytics functions such as predictive modeling and contribution of evidence-based medicine to improve health outcomes. The economic and administrative benefits are accurate, up-to-date, and complete information about patients at the point of care, quick access to patients' records, sharing electronic information, more effective diagnosis, safer, more reliable prescribing, enhanced privacy and security of patient data, and reducing costs through decreased paperwork, improved safety, reduced duplication of tests, and improved health. There are several barriers to the EHR, the main one being cost. The prohibitive cost of many EHR systems has limited access to capital and infrastructure. Limited access to EHR vendor information, which is usually proprietary and hence technical assistance. The suitability of EHR products for practice and rural health care settings. Difficulty connecting to or obtaining broadband service in these rural healthcare settings. Signatures are an important part of the EHR because the authentication of the health record entries is a requirement of state licensing, accreditation, and other standards. The purpose of signatures is to record the identity of the individual who performed the entry. Authentication means the corroboration that a person is who he claims to be. The security capability of an EHR system to identify the individual who digitally signed the document is called signer authentication. Another security aspect of the digital signature management technology is to ensure that the document and the signature cannot be changed or altered, which is referred to as document authentication. There are three levels of signatures found in the EHR. The digitized signature is a scanned image of an individual's actual signature. The next level is the electronic signature, which requires at least a password but can use a two-factor authentication method. The digital signature is similar to the electronic signature, except that it uses encryption to provide non-repudiation to prove the authenticator's identity, which makes it the most secure. Copying is the process of moving information from an existing health record. Pasting is the process of entering the copied data into the current record. Using the copy and paste functions to enter data into the EHR saves time because the information does not have to be retyped. But the process is not without problems. Health record problems that can result from the improper use of the copy and paste functions are: an entry can be nullified, an entire record can be suspect, healthcare practitioners may not notice additional information, healthcare practitioners may not notice missing information, the entry may misrepresent the case, it could be a fraudulent claim for reimbursement, could result in harm to the patient, and finally, there might be a sentinel event that must be reported. An audit log or audit trail is an electronic footprint of the actions that occurred in a particular file in an information system or that were performed by a specific individual. It maps when a file was accessed, who accessed it, how long they were in the file, what was done to the file, including printing and saving, which terminal or device was used to access the file, and so on. The EHR utilizes a multitude of tools to assist in the usability of the EHR. Among them are data retrieval, GUIs or graphical user interfaces, color and icons, data entry consisting of structured and unstructured data, template-based entry, natural language processing. Several unanticipated consequences have arisen with the use of the EHR, including increased work for clinicians, unfavorable workflow changes, ongoing demands for system changes, conflicts between electronic and paper-based systems, unfavorable changes in communications, negative user emotions, generation of new kinds of errors, unexpected and unintended changes in institutional power structure, and an overdependence on technology. Interoperability is divided into three levels: basic, functional, and semantic. With basic interoperability, a computer can send data to another computer, but the receiving computer is unable to interpret the data. Functional interoperability defines the structure of messages so that the receiving computer can interpret the data. The most advanced level, which is semantic, allows the information to be used in a meaningful way. Interoperability will require uniform standards for data capture, storage, and transmission. During the transition period, which is part of the information system implementation stage of the system's development life cycle, we have hybrid records. A hybrid record is a combination of paper and electronic health records. Hospitals will need policies and procedures to define the sources of the components of the patient's health information and to ensure easy and accurate access, use, and disclosure. The EHR does not eliminate the Health Information Management Department. However, the functions performed by the HIM department undergo significant changes and evolve. Some of the traditional HIM functions, such as assembly, are eliminated. The EHR decreases the dependence on transcription as providers more often perform data entry, including voice recognition, into the EHR. Functions such as coding are significantly changed. For example, computer-assisted coding technologies can be used to assign codes, but coders are still needed to audit and monitor the codes assigned. Release of information traditionally has been a slow process, but with the EHR, a few keystrokes will print or fax the documents needed to fulfill the request. In a hybrid health record environment, paper health records do not cease to exist immediately, but rather the paper health records will disappear over time.